So, hello and welcome to all. Thank you for making the time on this Wednesday afternoon to join the session by the CSN Network, the India chapter. I'm going to spend a couple of minutes just to talk a little bit about the Cancer Support Network for the benefit of everybody who may or may not be aware of what CSN is all about and maybe join the session for the first time. I'm going to follow it with a very quick introduction of Hitesh, who you see on the video already, and then I will hand it over to Hitesh to take forward the session. We will please continue to keep the questions coming, right? As in how you feel is right. We will be taking the question towards the latter part of the session. Just wanted to let you know so you're aware. So like I said, just to begin, a quick 2 minutes about CSN, right? The Cancer Support Network was started by late Sue Stemmel, who was a senior director in HRIT way back in 2008. That it's been like what 14 years since this network has begun. But in India, we started this, I would say, just before the pandemic hit, around February of 2020 is when the India network went live, and we've been doing many sessions ever since. A little bit about our network. We are here as a vision of CSN. We are here to enable the Cisco family, all of you and your families, right, to have a safe and inclusive place to share the experiences and learn from each other, right? No matter what geographic location you are at, no matter what country you work in or team you work in, it is a network common for all. We are a 700 plus volunteer community. It's a strong community. We help each other. We work with each other to ensure that we can do what we can for our Cisco family and their respective families. When it all started, like I mentioned, it was 2020. Here is a quick snapshot of the people who are associated, with this. I'm a co-lead, and I've joined by Hina, who is also part of this meeting, who is also a co-lead, and you see the other members here who are valuable members and executive sponsor of this team. Like I promised, I'm not going to spend too much time on us. Here is a list of how do you want, and if in case you want to join the CSN network, there are various methods for you to reach out to us. This information will also be shared over chat, and you can, kind of quickly go through the SharePoint site or send us a ping or join the WebEx team space or subscribe to the, mailer. So that's about CSN. I'm going to stop sharing, and I would like to, kind of introduce Hitesh a little bit, right, before I can hand over the baton to him. So Hitesh is Hitesh Goswami is the co-founder and the CEO of For Best Care, and he has over 18 years of experience in the industry, right, spanning from pharma to drug discovery and genomics industries. He started For Base Care with a vision to make technology affordable and accessible for cancer patients, right? The point being that he wants to look at for base care as a place where it personalizes the cancer care using genomics and digital health technology. And as a company, they have been leading the way to advocate use of genomic testing as a standard of care in oncology practice. So that's a bit of Hitesh Goswami. We are all here to hear Hitesh and what he brings to the table. So I will hand it over to Hitesh. Hitesh, over to you.
Thanks, Harish. Just wanted to confirm if I'm audible and my screen is visible.
Yes.
Great. So, firstly, Harish and Hina, congratulations on this fantastic initiative you're doing at Cisco with your Cancer Support Network. Very exciting to see such initiatives and corporates going on, and very excited today to be a part of this program and talking to everyone over here. Good afternoon, everyone. Thanks for taking out time today to be a part of this event. And what I'll be talking today basically is understanding the genetic basis of cancer, how cancer is the disease of the DNA, and could cancer be running in your family? Now, just a disclaimer before we start, whatever we speak to today, whatever we discuss today is not medical advice. We are not from medical community. We are a molecular biology and diagnostic company, and we are here to share our experience and our knowledge in terms of understanding cancer from the genetic basis. So as we mentioned, cancer is the disease of the DNA, and the changes in the DNA is what causes the cells to grow in an abnormal way. DNA, if you want to understand it even simplified way, it is made up of 4 letters, A, T, G, and C. In technical terms, we call them as nucleotide. And how many of such nucleotides are present? 3.2 billions, arranged in a specific manner. Now, whenever there's change in this arrangement, or change in the pattern in which these four nucleotides are arranged as 3.2 billion letters is what causes changes in the DNA and which can lead to an abnormal condition like cancer or many other diseases. So what are these changes? Let's get into it. So the first thing what we call is single nucleotide variant. So again, nucleotide is a single letter, A, T, G, or C. So the word itself indicates single nucleotide variants means there is a change in the single letter. So if you see over here, if the letter is supposed to be arranged in this particular way, cat, 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 now instead of A, there is a C, right? That is a single nucleotide change which has happened in the sequence of DNA, which has caused to produce a protein which may be in higher quantity or loss of protein, which has caused cells to grow abnormally. So this is one of the changes in the DNA. The second, what we called is insertions or deletions. So say if the sequence is supposed to be CTGGAG, now you are seeing over here addition of TGG, right, in that place, in between AG and CTGG. Now this is what we call insertion. This is another kind of mutation that happens in the DNA. The second one is deletion, where if it is supposed to be CTGGAG, now two G's have been removed. So that is called deletion. So these are three types of DNA mutations that we are looking into. Going forward, there's something called copy number variation. Again, the word itself indicates. So if a DNA is supposed to have a particular copy, the number of copy increases. It either duplicates or triplicates. There are more number of copies which are created for the DNA, particular region of the DNA. That is called gene amplification or copy number variation. And then finally, let's go to something called as gene fusion. So say a part of DNA codes for gene A and a part of DNA codes for gene B. Now gene A has a function of its own, produces a specific protein. Gene B has a function of its own, it produces a specific protein. Now fusion is an event where gene A and gene B fuse together, because of which either gene A has lost its property, gene B has lost its property, or they have produced a new property altogether or a new protein which is harmful and which is causing the cells to divide in an abnormal manner, which is causing cancer. So these are some of the events which happen in the DNA which essentially causes cancer. So how do we detect this DNA? What technologies are available to detect these changes in the DNA or in the protein eventually, right? So there are multiple technologies which are available. Something called immunohistochemistry, IHC, fluorescent in situ hybridization called FISH, PCR. We all are aware of PCR now because we've been using quite a bit in the COVID time. MLPA, Sanger, Sanger, ddPCR. These are multiple conventional technologies which were available and are available to identify these changes in the DNA, which are essentially used as a diagnostic techniques. Now, what has happened is, I don't know whether you guys are aware or not, in 2004, 2005, we completed the Human Genome Project, which was first time we were able to read all the 3.2 billion DNA nucleotides and their sequence in which they were arranged. The project started in 1989, it got over in 2004, and it took 15 years and $3.2 billion to study DNA and the letters of the DNA of one individual. In 2005, a technology called next generation sequencing came into picture. And today it allows us to read DNA of 20,000 individuals in one particular run itself, right? So the thing is that where it took us 15 years to understand one individual DNA, today we can do it at $3.2 billion. Today we can do it at $1,000. So that's how the cost has come down. That's how the throughput has increased. And that's how today we are in a very exciting era of precision medicine, right? Where earlier what would happen is that people were treated for a disease, but now people are treated based on the mutation. Just to give you an example, if all of us have a headache today, right? For someone, Disprin might work. For someone, Ceridon might work. For someone, a Crocin might work, right? Now, why it is different? Because we are different. The way we metabolize a particular drug is different, right? So for headache, you cannot just have one medicine which is going to work across the spectrum. So the same thing happens in cancer and many other diseases. Now that rather than treating the disease, what the world is moving towards is understanding the cancer, understanding the biology of the cancer, understanding the changes in the DNA which happens in the cancer, and the treatment is personalized, and that is the precision medicine. So today, next generation sequencing technology is revolutionizing how precision medicine is being applied in the clinics, and is revolutionizing the way the patients are treated, right? So that's from technology perspective. Now the big question: does cancer run in the family? Now, just to show you that almost hereditary. Now, here there are three words which are there. One is hereditary, second is familial, third is sporadic. So hereditary and familial. So hereditary is somewhere something where there is a known cause of cancer running in the family. Means there is very clear indication or information available, which essentially tells that yes, there is a hereditary chance of cancer running in the family, where we have identified a mutation or we identified the reason why it is running in the family. Familial is where there is a strong family history, but we have not yet been able to identify the cause or what is causing it to be hereditary in nature. But both are technically something which is running in the family. So almost 10 to 30% of all the cancers could be hereditary or familial in nature. And sporadic is something which is nothing to do with a family history or hereditary. It is basically because of environment, because of the habits, because of lot of other things which would essentially cause cancer, right? Now, basically, sorry, I'm not able to move the slide. Now, how do we know essentially if the cancer is familial or hereditary or it is running in the family, right? Now, there are certain cues that we typically get, which is essentially the flags for us to understand or try to have an understanding of whether something is running in the family. First one is being that someone very close, first line blood relative has been detected with a pathogenic or likely pathogenic DNA variant in the cancer susceptibility gene. So someone in the family has a cancer and they've gone for the testing and they have done one of the tests which shows that there is a mutation which has hereditary predisposition for cancer. So automatically that becomes a very strong sign or the red flag that yes, the cancer is running in the family. Second is someone in the family who is detected at an earlier age, young age of cancer. Typically, the cancer is at an age of above 50. But if you are seeing cancer in less than 50 years of age in a family member, or maybe now we have cases where it's at the age of less than 30s or in the 30s, right? Now, that again is a strong possibility of it being familial or hereditary in nature. A rare kind of cancer is identified in the family, right? Like breast cancer in a male, right? Or there are many such rare kind of cancers which are available, which are known. Now, those cancers are again something which is a strong sign or a red flag that it is running in the family. If you have more than two blood relatives on the same side of the family with the same cancer type who have been diagnosed at the age of less than 50, it's again a very, very strong sign that someone could have the cancer running in the family. So, yes, the 10 to 30% of the cancers run in the family, and these are some of the indications which will help you understand, uh, basically help to understand or get a red flag in terms of could it be running in the family or not. And then there's a choice whether to try to understand more who all in the family could be affected or not affected. Now that's a big question, right? That's a big question that we all want to answer. Um so if you look at understanding the importance of genetic testing today is one of the technology which allows you to understand if the cancer is running in the family. So if a genetic alteration is present in the immediate family members could have more than 50% of chance of having the same alteration. Other relatives are also at risk. So genetic testing is one of the technology today which utilizes next generation sequencing at the back end to identify if someone in the family could be at risk of getting a cancer when one other family has had that cancer. Now the big question is always is to know or not to know, right? Now there are technology today available which can help you identify the risk in the family, but do you want to know that answer or not? So let's look at the pros and cons of this. Now this is very, very important. So if you know if someone is at risk in the family, right? There are today opportunities where there could be regular follow-ups so that the cancer can be diagnosed early. and at a treatable stage. And it is known that if a cancer is diagnosed early, the chances of survival increases to 80% than if the cancer is diagnosed at the late stage. So basically, more early, more better it is in terms of the cancer management, right? There are a lot of treatment or management options available, which essentially can improve for the positive results, which improves the quality of life, what we call as QL, and which are less toxic in terms of the treatment. It also helps you to understand more about the risk in the family and talk to other members of the family early enough, right, for them to understand that yes, they are at risk of getting a cancer. Uh, so there are a lot of ways. So you can always talk to a medical professional, oncologist in this case, who can help you understand the results better. The genetic counselors who can help you understand the results better. They can make a family tree for you to identify the people who could be at risk depending on the test results and other things, and guide you in terms of the right actions that can be taken. But what are the cons? Now, the cons are in terms of that even if you know you have a risk of cancer, there's no way of stopping it. You can manage it, and you don't know at what age it's going to come. It can come any age between 22 or even lesser than that to say 70 plus or 80. You don't know. So that anxiousness, that anxiety would always be there, right? So it's an increased stress which would be there. It might lead to taking some life changing decisions. We'll be talking about Angelina case in the next slide, but there's some life changing decisions that needs to be taken which might have a long term effect on a physical and mental health, right? um, Thirdly is that if you have a mutation which is known to be cancer causing, at least that's a yes answer, right? But there are situations where the answer is either yes or no, means it's unknown. So where you find a mutation where the variation that we have found in the DNA, the significance is unknown, right? It could be pathogenic, which could be disease causing, or it could be non-pathogenic, which is non-disease causing. At this point in time, we don't know that information. So imagine having that kind of an information where you got the results and you are not sure for sure that whether it is genetic in nature, whether it is cancer causing or not cancer causing. It causes a lot of anxiety. Then of course a negative test does not eliminate a person's risk for cancer. So these are some of the things which are there, but look from ethical perspective now, right, which I have not covered here, but just thinking about it. Now suppose someone is getting married and they know that they have found a strong pathogenic mutation, right? uh, and how would they communicate to their family members, to other families? A lot of these situations in the social perspective, which can come in front of an individual having known this information and how they are going to manage it. Now, there is no easy answer as to whether yes, we should know or not know, right? That is why to know or not to know is a very very big question. It completely depends from person to person, how they are looking at this whole situation, and it's their personal decision. Of course, it's always better to seek professional advice either from a genetic counselor or oncologist if you think if some of the cues that we mentioned, right, could be there in terms of cancer running in the family, like someone at the age of less than 50 having cancer at multiple sites, or a rare cancer, or more than two family members from the same bloodline getting affected. These are the cues. So it's good to talk to an expert before taking any decision, but the decision is purely personal. It changes from person to person. Like in the case of Angelina Jolie, the Jolie effect. This quote came into light in around 2013, when actually Angelina Jolie spoke about her decision of removing her breast after testing for BRCA1, which is one of the very well-known gene, which if it is positive or it is pathogenic in nature, there are more than 80% chances that in your lifetime a person would get cancer. So she had a very strong family history, because of which she decided to do a testing for this particular gene. She identified she has a mutation. Now, from her perspective, she did not care about the society. She did not care about anything else. For her, being with her family, having a longer life to spend with her family, her kids, and all is something which was more important than a societal stigma. Because someone at her kind of a status, right, who has cancer, to come out in the open, take a life-changing decision of removing both her breasts, right, is something which is very, very powerful to be done from her side. And the kind of, I think, the awareness that she created about familial or hereditary risk of cancer is something which we saw the effect in 2013 itself, where after she spoke about it, there's a very increase in the number of genetic testing which were done for breast cancer, especially. So, but again, it's her decision, that's her choice, that's her life, that's her thought process. Now, that would be very different from different people depending on their current situation, right? And it would depend completely from individual to individual. So it's very important. Again, I'm saying that if you think based on the points that we discussed that there is a chance of cancer running in your family, it's very important to get a professional advice from an oncologist or a genetic counselor, understand the pros and cons, and take a decision whether you want to get tested and know for yourself whether you are that member who has basically got this genetic risk in your DNA. So that's pretty much about cancer and cancer running in the family. I tried to make it as simple as possible, and I've made it short because so that we have more time in terms of discussions than just being a monologue from my side and me talking. Again, just to give you a disclaimer that this is not a professional medical advice. This is our experience and expertise working with number of cancer patients that we are sharing, and of course the scientific advances and the literature which is available that we are sharing with you. For any professional medical advice, please reach out to you medical professionals like genetic counselors or oncologists for any further information. We are on a vision where, as a company, we believe that cancer is something that cannot be won alone, and we need to join hands together with people with similar thoughts, similar passion to fight cancer, and build a very strong ecosystem. Something like what Hina and Harish are doing at Cisco, right? They're building an ecosystem. They're bringing people together to talk about cancer, to learn from each other's experience, to learn from each other's expertise. So we also have the similar vision, which is why we're very happy to be a part of this program today. And if anyone wants to join the fight against cancer or know, get more information, you can email me on hitesh@4basecare.com. We'll be very happy to help you in whichever way we can and connect you to the right people. Even if we don't have the information, we'll be happy to connect you to the right people so that you can get the right guidance. So that's from me. Again, thank you very much for the time, and I hope this is helpful and very happy to take the questions. Thanks.
Yeah, absolutely. Thank you so much, Hitesh. This really helped, right? I mean, the way the presentation was framed in terms of what cancer is all about, and then we spoke about, a few more, the growth in the industry, right? I mean, 15 years, $3.2 billion, one person versus, $1,000, and probably just, a fraction of the time, a fraction of the money, and more number of people being, we are able to kind of, track their DNA and understand a lot more about it. I think that is evolution, right? That is evolution where we've started from somewhere and reached elsewhere. And the other important thing that you really touched upon, I really, really loved it, was the Jolie effect, right? There was so much there was so much change that she brought, right? The stigma, the thought process, everything changed. So I think great points covered. Thank you, Hitesh. We have a lot of questions, and I'm going to keep asking them one after the other. Before I get to the question, I just want to kind of let all of us know that we've got, Dr. Anupama Menon and Padma, who are both part of LCHC. They've joined the session. We've got Rohit and Munjal, who are part of the CSN network, who've joined, and Hitesh is also joined by a couple of his team members. So I'll just go ahead and ask the questions, Hitesh, and you can go ahead and provide the responses to the best of your knowledge. Um, and Dr. Anupama, if ever you feel that there is something that you would like to add, please feel free to do so. Right, you're our in-house resident expert, and we would like to hear from you as well. So thank you for being here. This question is from the first question, which I see is from Manjunath, and the question is, does the gene variation happen during anyone's life as they age, or is it carried since birth, right? We're talking about the gene variation specifically. Is it age related or is it from birth?
It's not necessary that it has to be from age related. Of course, the environmental factor plays a lot of role in DNA changes which happens in a cell. So a classical example would be Chernobyl, right? Where this large amount of radiation which happened, which changed the DNA of the individuals who were in that vicinity at that point in time, which caused a lot of radiation and radiation related mutations in the DNA. And then there are classical examples like habits like smoking or drinking, as we know of them, right? And there's some places, some regions, the gastrointestinal cancers are higher compared to other regions, mainly because of the food habit, the kind of spices which are had in the food, and a lot of other things. And then, if you know that many of in Northeast there is a high incidence of oral cancer because of gutka chewing, tobacco chewing habits which are there. So there are a lot of environmental factors, pollution, and everything which does play a major role throughout the lifetime of an individual, which causes the cancer. So such mutations essentially, this would be a good time to talk about. There are two kind of mutations that are there for cancer. One is the germline mutation, which is essentially something that you're born with, which is hereditary in nature, and somatic mutations, which are essentially something which is caused, which you find in the cancer cells, right? So these are the two different kind of mutations which are there that we try to understand when we are trying to understand the cancer also.
Good, good. Thank you. Thank you for that, Hitesh. Now, I have one question, but multiple people have asked different variations. So Revant, Bhanupriya, and Juliet, all three have asked a question related to each other, right? I mean, is there basic test or tests that can be performed to detect cancer? If there is, just to kind of maybe clear your doubts or just to kind of see if you are, where is it that you are at right now, from a cancer perspective. So, any insights on that, Hitesh?
There are two things essentially, Harish. One is that why are you screening for cancer? Is it that you are just curious about it as a part of the regular health checkup that we generally go and do? Or you are doing it because, like what we discussed, that there are red flags which could be the reason where you think that it could be running in the family, right? Now, it is just from the case of being curious. There are a lot of technologies which are being developed, and currently, I think they have been. They have been implemented in the US. So company called Grail, I think it would be nice for people to look it up. Grail has developed this
Can you spell
blood
that out
test,
just for the benefit of everybody?
GRAIL. Maybe I can just
GRAIL. Okay.
right, which essentially have developed these blood tests where from the blood they can in normal individuals they can identify if they are having cancer or not. That is early detection.
Mm-hmm.
Second is so they I don't think they're looking into genetic predisposition and all. No, they are just looking at early detection. So they are like, if someone is predisposed to cancer, someone wants to think that they're having cancer, it's an early detection method. It's being used in US. I don't know whether it's come to India. I don't think it has come as of now. From the perspective where you want to look from genetic predisposition, that do you have that particular mutation running in the family, or there's a familial or the genetic risk. There are a lot of companies, including 4 Base Care, which has similar kind of a test, which essentially looks for mutation firstly in the proband or the person who has the cancer, and then we basically map out the family tree and look at who are at higher risk and suggest that maybe they can do a particular test if they want to know if they are at risk or not. So there are a lot of tests which are available, which is including a 4 Base Care. So anyone wants more information or genetic counseling, very happy to connect them to our team post the event.
Sure, sure. Awesome. Thank you, Hitesh. I have a couple of questions from Tarun. I think they're both related. The question is perium pylori, and I'm sorry if I'm pronouncing it wrong. It's perium pylori cancer. Is it hereditary? And is it related to like breast cancer, or is it some other area in the human body?
I think the right person to have answered this would have been my clinical director, who is not here. I am from molecular biology background, not much from the medical side, so I might not be the right person. But again, if you can put this question offline, I'll ask one of my team members to maybe get in touch with Aruna, or maybe send an email out, or connect to the right people, because we have a strong network
Right,
of doctors. So maybe
right,
connect to the right doctor, oncologist, who would
right,
be able to essentially provide this information.
right, right. Okay, sure, absolutely. Makes sense. Um, Good. So I'm moving on in the questions. Now, we have Jyotsna who says, my mother-in-law's two younger brothers expired due to cancer. So sorry to hear about that, Jyotsna. So does this indicate that cancer runs in the family? I mean, it's a genuine concern, Hitesh. What would you like to share about that?
It's a strong possibility. It's a strong possibility because close blood relatives who had cancer and they have expired. It's a very, very strong possibility that the cancer is running in the family. Now whether we know the cause for it or not, it's a different thing altogether. Like what we mentioned, could be hereditary or familial, right? Hereditary, where we can identify the cause. Familial
Yeah.
means it is still running in the family, but we don't know the cause. But of course, again, genetic testing might help give that answer. But now the challenge would be that since both the uncles have brothers have passed away now, if we had ideally is if you have the blood available for the proband or the person who has the cancer, it becomes easy to correlate with the other members who are doing a test. But even without that, there are ways of identifying the mutations if they are there, uh, to say if they are at risk or not. Yes, but it's a very strong possibility because it's a
Okay.
strong family history.
Okay. 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 Cool. Thank you, Hitesh.
Again, Ari, just to add over here, this would
Yeah.
mostly be from mother-in-law side, not in the father-in-law side. So the member at
Right.
risk could be from the mother-in-law side of the family.
Sure, sure. Okay, okay, cool. Thanks for that. A question from Vinay. Germline testing helps in identifying hereditary and familial cancers. It's a question saying, I mean, does germline testing help in identifying hereditary and familial both types of cancers, or is it
Yes.
any either one?
No, it does help you identifying both. The simple answer is yes. It
Okay.
helps you in identifying both familial and hereditary cancer.
Good, 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 good. Awesome. Thank you for that. Now, a question regarding to treatment, right? And again, we all know that for-based care is more to do with. I mean, you as such wouldn't be able to provide specific medical advice. We are all aware of that, but still, I'm going to ask a question, and feel free to add how much ever you know, and kind of maybe help all of us here. The question is chemotherapy the first treatment for any cancer, right? I mean, for instance, I think in this case, probably it's a kidney cancer thing. This question is from Ashish. And is it advisable for kidney cancer? So,
So great. So let me explain you about the cancer treatment. So cancer treatment, essentially there are two modes of treatment majorly. One is surgical and one is the drug treatment. So surgical treatment essentially happens when the cancer is identified at an early stage and cancer is small enough for it to be surgically removed, right? So that's where the treatment happens. And that time they do chemotherapy also, something which is called adjuvant or neoadjuvant, correct? So neoadjuvant is where before starting the surgery, they'll give a radiation or the chemotherapy to make the cancer maybe smaller in size before they remove it, and then they do the surgery. The second is adjuvant, where after doing the chemotherapy, they would give an adjuvant radiation and chemotherapy, where the residual tumor tissue, which could be remaining after doing the surgery, is there. So that is the early stage cancer treatment. That is one way of doing a cancer treatment. But say if the cancer is too big enough
mm,
for it to not be reduced in size, even with the neoadjuvant treatment, or it has spread to different part of the body, what we call as different part of the organs of the body, what we call as metastasis, right? Then it's not possible to surgically remove different sites, right? This is where a standard drug treatment comes into picture. Now, drug treatment today, there are a lot of options. There are chemotherapy, there are targeted therapies, there are immunotherapies, there are multiple options which are available.
mm,
Um, Still, I think as a standard of care, chemotherapy is the first line of treatment which is preferred, where doctor would go by the guidelines of providing a chemotherapy. And if the chemotherapy is not working, then what they will do is they will do a molecular testing this is what we call somatic testing. This is not a germline testing because here we are looking at the mutations in the tumor tissue, not in the blood, DNA from the blood. We are looking specifically from the tumor tissue. So a biopsy is done at the tumor site,
Mm.
and that tissue is taken to the lab, and we do comprehensive molecular profiling to see if there are mutations for which approved treatments or clinical trials or any research is on, which is being developed, right? So, targeted therapy, first line of treatment, I think most of doctors in India still prefer doing a chemotherapy. But if chemotherapy is not working, then they get into molecular profiling or the biomarker testing of the cancer, and they like to look at what markers are there and can the treatment be tailored according to tumor tissue mutations, than doing a standard treatment. I hope that answers the query.
Yes, I think you gave a lot of depth on, the kind of, treatments that are available, from a focused area to, being affected the entire, having been affected the entire body, and also, the kind of DNA that we have from a Caucasian versus the other population. So thanks for that. I have a ton of questions. I'm going to be a little bit more faster now. There was a question related to chemo, right? I mean, a very quick question. What is better, chemo or immunotherapy? Of what you said, what I'm understanding is that they both are independent of each other and they both do their own respective jobs, but maybe I'm wrong at this, Hitesh. What do you
Right.
want to say for that?
So, of course, like I said, the first line of treatment by any doctor would be chemotherapy, no doubt. They would not start immunotherapy right away. But what they do is, so immunotherapy, there are certain markers. There are three markers currently, which are depending on the cancer, which are known to be a strong indication of whether immunotherapy will work or not. One
Mm,
is called a protein, which is called PDL1. So what they will do is, like what we mentioned during the presentation, there's a technology called IHC or immunohistochemistry,
mm,
one of the conventional technologies, right? Where they would do IHC to identify if PDL1 protein expression is higher or lower in the tumor tissue. If it is higher, then it is known, and in fact, FDA has approved immunotherapy as a treatment for solid cancers. Mostly,
mm,
the poster child, I'd say, of immunotherapy is lung cancer, but is known to be effective in a lot of other solid cancers also. Then there are other two markers called MSI, which is microsatellite instability, which again is a pan solid cancer marker. When I say pan solid cancer marker, means any solid cancer, if MSI is high, there are immunotherapy is known to work. It does not mean that immunotherapy will work, but there are statistics is more biased towards immunotherapy working than not working, right? Then there is something called TMB, which is tumor mutation burden, where uh, say if we take the tissue, and in the DNA, a stretch of DNA, we identify how many mutations are there. More mutations are there means tumor mutation burden is high, and
mm.
less mutation is there, tumor mutation burden is low. As simple as that. Again, so if tumor mutation burden is high, that is another indication that immunotherapy might work. But again, like I said, that doctors would typically
Doctor,
look at
yeah.
immunotherapy mostly after doing the first line of chemotherapy, and second, even sometimes they look immunotherapy and chemotherapy as combination,
Mm,
right? Not just one, but combining both the therapies together, which is called combination therapy,
yeah, yeah.
which is used by a lot of doctors.
So I think it would be safe to say that it's a very case specific thing, right? Generically, this is how it is, but case specific, there might be a combination versus step one, step two versus, the other way around. So I think, would that be a good way to summarize it, Hitesh?
Right, it is a good, yes, that's a right way to summarize it. But we strongly believe that as soon as the chemotherapy is starting, even the first line treatment, right, it's a good idea to do a molecular profiling and understanding if there are any targeted therapy options available.
Mm, mm,
Because
mm.
that, if at all the chemotherapy is not working, we are losing a lot of time.
Right, right, right.
While the chemotherapy is going on, if molecular profiling is done, we have option where targeted therapy could be used or the treatment can be changed immediately,
Mm,
right?
mm,
Whereas if we do it for chemotherapy to not work and
mm.
then do this, we're losing a lot of time,
Right,
correct,
right.
in between. So that is one thing that we strongly advocate as a company that should be done. And that patients should be aware that biomarker testing today is changing the way the clinical outcomes are there. The toxicities is much lesser compared to chemotherapy. If you identify targeted therapy drug for your treatment through molecular testing, then the treatment, the quality of life, the treatment outcomes are much better compared to when you do a chemotherapy.
Yeah, yeah. Okay, cool, good. Another question, and that question on chemo versus immunotherapy was from Harjinder. Tarun again asks, would a full DNA analysis be able to uncover the propensity for certain types of cancer? I mean, of what we spoke, Hitesh?
So the science is still growing, and every day we are getting more and more information. So currently there is limited information or limited genes for which a direct correlation is there between cancer being hereditary nature or not, right? But I would not say we are 100% there. It's an ongoing process, but because of advancements in technology like next generation sequencing, we are going there at a much faster pace than what we were doing it earlier, right? So I am sure that within the next 10 years, our
Yeah,
understanding of cancer and the molecular biology of the cancer would be at a different scale than what it was a decade back. So that's that we are very positive about it. But right now, of course, there are limited information. But that limited information also, if we can just look at in the case of Angelina Jolie, there's just one gene, right? BRCA1, right? Just one gene. So that limited information also is very valuable if we are able to
yeah,
identify it.
yeah, sure. Okay, good. A question from Periyanagi is so if the father has been diagnosed with colon cancer stage 4 and the father's age is 70, 70, at what age should the son get tested, right, for cancer screening, so to say, right? And what are the kind of tests that the son needs to go through? Any insights on
So
that?
again, if I had to give a suggestion, I would first look at the father. I would first do a germline testing for the father to see if there is a familial or the hereditary risk, because it's 70 plus, so it could not be hereditary or familial at all,
Mm,
right? So no need to worry about it, because 70 plus lot of people get cancer which is sporadic in nature, not familial or genetic in nature. So first I would identify if the father actually is carrying a gene because of which the cancer is grown and it's hereditary or familial in nature, and if so, then we can map out who in the family could be at risk and evaluate whether they should be doing the testing or not. So
mm.
unnecessary doing testing also, just because someone has cancer in the family does not mean it's familial in nature. Just remember it's only 10 to 30%. Remaining it's all sporadic.
Okay, okay, cool. And this question is from Devashish. Any places in Bangalore for genetic testing?
You can come to Phobase Care, of course. You can you can write to us. Our team of experts will get in touch with you, try to understand the current history
Yeah,
in the family, and then suggest. Like I said, that see, as a company, our objective is not to do more genetic testing, but identify the right candidate for which a genetic
right,
testing might
right.
be helpful. Again, like I said, that to know or not to know is very important. It's very important. If you get a mutation now, are you ready to deal with it? Correct. So before that, you need to get into genetic counseling, maybe even psychological counseling, right?
Yeah,
Before
yeah,
taking that decision rather than
yeah,
rushing into it.
yeah,
Maybe what I'm saying is counterproductive to my business, but we are not looking from that perspective. We are looking from giving the right advice at this point in time
yeah.
so that people
Because I
get
mean,
the right.
yeah, it's that ethics side, right? I mean, ethics of,
Right.
what am I going to do? What if, right? The what if is that question which has never been answered. What if? And yeah, I completely understand. And thank you for sharing that. What would be the kind of extrinsic factors which could make you more susceptible to cancer? This question is from Anita. What are those extrinsic factors which we want to kind of just be aware of, which might impact or
So
make you more
many
susceptible
of
to
the
cancer?
many of the things that we covered, right? Try to somehow the general habits, right? We try to eat food after washing it
Mm,
thoroughly or boiling the water and all, so that some, especially in the food perspective, a lot of the pesticides, if there is a high pesticide content, that is taken care of. The general hygiene and habits, I think that is healthy habits would definitely make sure that we are at less risk of cancer. Of course, there are, and I'm like, if you're living in a place where there's a lot of pollution, you might want to figure out to get an opportunity where you can move away from that place. It's a
yeah,
great opportunity to have. But again, there are a lot of lifestyle choices, a lot of
yeah,
things
yeah,
which are there.
yeah.
But one thing is that what I believe is that sometimes having information, we had this case, I cannot disclose much, but there was this case where the patient had a neck cancer. And we found there is a mutation which could be familial or hereditary in nature. And that individual had a history of smoking and drinking, right? And they got cancer at the age of around 38. Now,
Mm,
imagine you have this information in hand earlier that you are susceptible to cancer. So
mm,
you'll avoid doing a lot of things or make those lifestyle changes in the habits and a
yeah,
lot of other things
yeah,
which might actually help you in avoiding it. We might not be able to avoid because it's hereditary, it might come at some point in time, but you want to
Right,
just take right decisions, right?
right,
So there
right.
are a lot of ifs and buts, this and that over here.
Yeah, yeah, yeah. Understood, understood. And something very related, and I think this could be a quick one. From Guru Prasad, it says that do environment factors also do they affect the gene mutation, right? I mean, we
Yes.
speaking of it does. Okay.
Like what we discussed, right?
Yeah.
Chernobyl, radiation mutation in the DNA.
Right, right, right.
Bhopal
Yeah.
gas tragedy. We look into that. Now, how is the cancer causing? Because of the radiation, which has caused changes in the DNA.
Mm,
Correct.
okay. So it's those high volatile things, right, where you have, either the gas leakage or that, the nuclear mutation, the
Correct. It's,
nuclear
it's essentially an insult, continuous insult to the system.
to the
So, see,
system, right?
smoking. Why some people get mutation, some people don't get, right? Now, smoking, what essentially happens is there is a continuous insult to the
Mm,
lung cells, which is happening. Now, at
mm,
some point, the cells will change. They will try to combat that insult which is happening, right? And sometimes that change can lead to cancer. So
right,
it's not just
right,
about insult which is continuously happening to the system. It could be anything. It could be multiple factors.
right, right, right. Got it, got it. Um, this is from Sushant. In India, how can we get genetic testing done? What would be the approx cost, and is it possible to get the samples taken at home and when for testing? So I think this is something that you've already answered, right? I mean,
Right.
you would like to probably have them write to you, and then you can probably, kind of decide what's the best course of action
Right.
for them, right?
Right.
It does not necessarily need to be always a yes, but it could just be trying to understand if it does make sense.
Correct.
Um, is the next question, what are the different treatments available for cancer treatment? I think this we've already touched upon. Was from Swapnil. We did, touch upon it in different, areas. Does food habit increase the risk of cancer, especially using plastic containers? I think we touched upon a lot about food, washing vegetables, the environment factors, but this thing about plastic containers has been around for a while. Can you touch a little bit upon this, saying, using plastic containers, using certain types of, cooking material or eating material, does that have any impact on cancer, if at all?
I'll be a hypocrite if I say that because we all use plastic material very frequently in our habits, and we all know that it could have harmful effect on the health, on the body, and it could lead to situations like cancer. But again, no definitive answers in terms of what kind of grade of plastic, what not, what not. So of course, best is to avoid. So
Yeah.
we have we have tried now in the family that we have taken decision that we are not going to microwave anything which is plastic. So if you have to microwave, even if the that it says that it is high quality and can be used, no, it has to be a proper container and all. So
Right.
yeah.
Okay. Cool.
It
Good.
could, and even like I said, even spices. So we have seen that certain states in South have more instances of gastrointestinal cancers, right? And that is mainly because of spices that is used in the food, which is very high concentration or high content compared to many other places. So of course, diet does play an important role,
Mm.
but there is no strong scientific evidence which clearly says that if you do
Okay.
this, it's going to happen. But there are a lot of evidences which says that yes, there are more instances basically of cancer in a particular region because of ecosystem, environment, food habit, lot of other things.
Right. Right. Okay. Cool. um Now, something to do with, I was just reading the question, where did it go? Yeah. So is working near RF signals such as Wi-Fi or 4G, 5G, in any kind of environment, be it an office environment or others, is that something that can cause cancer? The RF
Again,
signal.
very subjective question, Harish. There's no definitive answer to this. We are next to a phone all the time. In fact, the phone is right next to me right now. Even while sleeping, it's just on the table. So we are constantly in that kind of a situation where we are exposing ourselves. So maybe current generation, maybe we are seeing more cancer in the younger age. Could be because of the technology advancement. So everything has a pros and cons, right?
Right. Right.
Everything has a pro and con.
Yeah.
So now, but there's again no definitive answer. I cannot say that, okay,
Agreed.
this.
I understand. Yeah. Yeah. The There are a lot of questions around, do pesticides, used in the food industry, can autoimmune disease triggered by lifestyle issues, all they develop cancer. So I think we've touched upon that in one form or the other. So I'm not going to really delve deeper into it. I'm just skimming through the questions and which are the ones which I want to, probably ask specifically, which we've not covered. Um, can leukemia and HCC, that is hepatocellular carcinoma, can they be genetic? And if someone has these in close relatives, there is a risk of mutation running within the family? I think we have asked this, but again, I want to be specific. The reason I'm asking is because of the specific names, leukemia as well as HCC.
See,
For
I think every cancer can be, any cancer can be hereditary in nature or familial in nature, right? Maybe we might not have the answer right away, but like I said, that the clues are where if there is a strong family history, very high chances it is hereditary or familial in nature. It could
right,
be any cancer for that matter, right?
right,
So
good.
I think any cancer can be familial or hereditary in nature.
Sure. Okay.
It's better
Uh,
if you want to know, it's better to get tested. Again, the
yeah.
important thing is to know or not to know.
Yeah, yeah, right. And also to really understand if the test is required, right? That's why, like you said,
Right.
you need to probably consult. There cannot be like one size fit all answer when it comes to questions
Correct,
like this, is
correct.
what I understand. There is again questions about, right? I mean, so there is one that we're talking about, the kind of testing that you provide, right, as a company. Apart from that, are there any tests that you would want to suggest? Like, for instance, I personally, when I do my, annual health checkup, I make sure that I go through a PSA test just to make sure, right, from a prostate perspective, I want to get it done like once a year, once in 3 years, something like that. Are there any specific tests? And I understand this might be going against your company per se, but I know you're a very open person. So are there any
Yeah.
specific
No,
tests
no,
that you want
no,
to call out?
nothing like that, Harish. Nothing from company perspective. I think not for many other cancers, but see, cancers like breast and all, right,
Mm,
where there are a lot of options available where women can be more conscious about doing a regular self checkup or checkups at the healthcare organizations, which can help in identifying early because that is one of the cancer which is very much in a situation where we can catch it early, right? At least in large majority of the cases. So other than breast, I think we will have to talk. We might have to maybe have a session with
mm,
some
mm.
oncologist on this particular because this question looks very common question which is coming up, right? It would be a
Right.
good idea to have a medical oncologist or a surgical oncologist or anyone actually have a session which can talk about the early detection methods for
Right.
cancer other than molecular biology because there'll be other techniques which I don't have expertise in,
Mm,
so I
mm,
might not
mm.
be able to comment much.
Right. Okay. Okay. Fair enough. That's a fair answer. And eh, so again, this I think this question comes back to the kind of the tests that we're talking about. So I'll probably make it a bit more wider, right? This
Right.
question is from Shilpa, and she's talking about, right, are there any side effects of getting the testing done? Right now, this testing, I'll probably make it a little bit more wider and say the testing of the test that you do as an organization, and also the other tests that are available. Probably a couple of things that we just mentioned in the previous question, Hitesh. Any side effects that you want to talk about or people need to be aware of?
Most of the tests don't have any side effects as such, other than maybe we doing a PET CT scan or MRI,
Mm, mm,
which is not advisable to do it routinely, correct?
mm,
Where there are radiation risks. Other than that, I don't think most of the tests have any side effects. In fact, there was recently something that I was studying about biopsy or surgery. Can that cause the cancer to grow? But there are no evidences. There is
mm.
just thought process that maybe doing a biopsy or surgery can cause cancer to grow, but there are no known causes like that which are there. Only risk, like I said, is especially in the genetic testing is the risk of knowing it. Are you prepared
Right,
for it? Right.
right,
That's a major risk because that
right.
will change a lot of perspective in the family overall. So, and even with lot of other tests like PSA and all you mentioned, if you can do it early, catch early, great, right? There's
Yeah,
no side effect. The same thing with doing a routine breast examination. There are no side effects. Right now, there is a company called Niramai, which allows you to do breast examination, early detection, even without doing a mammography. Correct. So they have this AI-based thermal screening procedure, which
yes,
allows, right?
yeah.
I think again they would be a great guys to have on board for early detection in breast cancer. But yeah, there are ways. I don't think most of them have side effects, especially in genetic testing. The side effect is only from perspective of the information that will come to you.
Mm, mm. Okay. Okay, cool. Thank you for that. We have 4 more minutes for the session, so I'll have to skip many questions. I'm just gonna pick a few. You did touch upon PET scan as well as biopsy just now, right? While you were explaining this, while you're providing your response to the previous question. The question is related to it. Now, is PET scan final or biopsy, right? My understanding of whatever I've seen is that these both hold their own space, but the question is a bit more detailed, saying, for instance, if biopsy shows a tumor and PET is normal, right? This question is from Hima Bindu, and they're asking, is PET scan final or biopsy? And I mean, if biopsy shows tumor but PET is normal, what does that indicate? I mean, what should we read out of it?
Again, largely medical question, Harish. I typically that's a very rare situation where you get a PET scan where you've not seen a cancer, because how would you do a biopsy without you identifying the site of the cancer, which would be essentially to a PET CT scan, correct?
Mm,
And
mm,
then you
mm,
can do biopsy for that site, right? So
mm.
only if you have an inkling of it being cancerous is when you take the biopsy to understand whether it is cancerous or non-cancerous. The tumor can be both, right? It could be cancerous or non-cancerous.
Right.
Cancerous means it will grow rapidly, it will go to other sites and
Mm,
all those
mm,
things.
mm.
Non-cancerous could be benign in nature. It's just tumor is growing and just cut it
Right.
off.
Right.
So for that, of course, biopsy is done, but before that, you have to identify using a PET CT scan
Right.
where in the body so they're very rare situation where this can happen. But then I would not be in a position to answer that.
Yeah.
What to
Sure.
make out
Sure.
of it?
Okay. Cool. Thank you.
Harish, Dr. Anupama, if
Yes.
I
Go
may
ahead.
just
Go ahead,
add on
doctor.
to what just
Yes.
Hitesh
Yes.
was mentioning. So PET CT scan and biopsy are entirely two different things. When he was talking about two types of cancers, the one which is localized in one particular area are local cancers, and the cancers which are spread to different parts of the body, they are called basically metastatic cancers. So
Mm.
biopsy is when you are suspecting cancer in one particular area. Suppose we're talking about breast cancer, you have a doubt, you want to check for a cyst or a solid tumor there, you do a biopsy. But if you want to check if this cancer has spread to other areas, what you do is a PET CT scan to check if there are any other reactions or any other lesions anywhere else in the body. So
Mm.
entirely two different things. It does not, it never means that if you do a biopsy, you can avoid a PET CT scan. It never means that if you do a PET CT scan, you don't have to do a biopsy, because biopsy not only tells us if the cancer is benign or malignant, it also tells us what type of cancer it is, what stage the cancer is, different information that we get when we do a biopsy also.
Right.
Entirely
Right.
two different tests.
Cool.
Right.
Awesome.
And
Thanks
just
again.
one more point which I wanted to add. I was listening
Yes.
to
Please.
Hitesh
Please go ahead.
speaking. We spoke about, are there any side effects of these cancer screenings?
Mm.
There may not be any physical side effects, but what we have to understand is unnecessary screening and too much of screening is going to put a person through a lot of mental agony. So it is only with the discussion with your
Yeah.
physician that you have to decide if you are the right candidate to do any kind of screening. Like a blanket cover, we don't want to do screening for everybody in the community. It is
Right.
just going to increase your mental health burden.
Right.
Right.
Right. Right.
Absolutely.
Thank you.
Yeah,
Absolutely.
absolutely. Thank you so much, Dr. Anubhav. And I think we did touch upon this saying, it's a case by case basis. Talk to your medical practitioner, really understand whether this is required, not required. So thank you for adding that, stressing on that. We are on time, and I think I have so many other questions that I will not be able to touch upon all of them. What we will do though, is that, we will work with Hitesh and Dr. Anupama and try to get answers to as many questions as we can. And probably we'll circle back to the team saying, hey, these are the kind of responses that we were not, these are the questions that we were not able to touch upon. But I want to take this opportunity to kind of really thank you, Hitesh and Dr. Anupama, Ramya, Munjal, Padma, Hina, all of you, to be a part of the session and really make this such a success, right? We had for almost 650 people who joined. I'm certain that many of them did get a lot of, great information. They learned a lot about, the latest happenings, and I'm sure you would be getting a ton of emails, Hitesh, right? Just be ready to start looking at those emails and just see how you can help them. So please do, and definitely look out for an email from me, which is going to be with a set of questions that are unanswered, and so that we can get them answered. But yeah, I mean, I would like to say a huge thank you to everybody who joined and to all of our, esteemed panelists to be available here and making the session such a grand success.